I'm Dr. Dallas, and a lot of people ask, can I get an additional round of fat into my bottom, or what we call a secondary BBL? And the reason someone might be getting that is just because they probably want to be a little bit larger, or there might have been a small area that needed filled out a little bit more, maybe a hip dip that it didn't completely fill out, maybe a little indentation on a certain portion of the bottom. So oftentimes when you're putting in fat, remember, we're limited with how much we can put in by how big the initial starting butt is. So if someone has a very large butt, or I should say a large subcutaneous space, there's a lot of room to put that initial fat. But if someone's really thin, sometimes we get really thin people who are like only 110 pounds, their subcutaneous fat is like this. And so you can only put so much, because if you overdo it, you're not going to get the right look, or you're going to get a lot of reabsorption of that fat. When you think of the bottom, we think of the subcutaneous space as being the soil, right? And the fat that we get, that we put into the butt, is the actual seeds that we put into the soil. If someone doesn't have a lot of soil, then you can only put in so much seeds. Because you've overdo it, you put too much fat, it's not going to take, and it's all going to get reabsorbed, or you can get a lot of fat cysts. So you have to be very careful when you do that. So when really thin, you can only put a little bit of seed. But let's say that small person wants to come in and have a larger appearance. Well, they'll come in for a secondary BBL. We take more fat. Now their soil is now bigger, so we can put more seeds. So actually, the second time around, you can actually do more. So for our thinner patients, when they come in for a second BBL, it's because we sort of gotten the soil ready to put in a lot more. And some people need that second BBL to achieve a little bit of a larger look. Now, someone's a little bit bigger, who has more soil to work with, a lot of fat to work with, we can actually put a lot more in that first stage. But there's a few different reasons. Those are some of the reasons that we do a secondary BBL, but that's how we're gonna help our patients get the best look. And we have to be giving these patients the conversations about what we can do if we don't achieve the look, or we can only do so much the first time, and we're gonna probably have to do a second BBL if you wanna be that big.